Olá pessoal, sejam todos muito bem-vindos a mais um SBQTalk, podcast oficial da Sociedade Brasileira de Quadril. Meu nome é Gabriel Rodrigues Silva, também especialista em cirurgia de quadril, e hoje estamos aqui com um convidado mais do que especial, Dr. Daniel Berry. Vou ler um pouco o roteiro desse doutor para vocês entenderem um pouco a expressão dele hoje, tanto nos Estados Unidos como também para nós aqui no Brasil. Dr. Daniel Berry é ex-presidente do Departamento de Cirurgia de Ortopedia da Mayo Clinic em Nova York. Desempenhou inúmeras funções de liderança tanto na sociedade americana como também na cirurgia do quadril. Tem só de publicações em artigos mais de 470 artigos e já editou mais de 10 livros sobre a cirurgia do quadril e do joelho. Então aqui vocês já entendem um pouco da expressão que é o Dr. Daniel Berry. E agora nós vamos falar um pouco mais com o Dr. Daniel Berry sobre a formação do cirurgião de quadril nos Estados Unidos. So, Dr. Daniel Berry, it's a great pleasure.
Good morning. It's great to be here.
Yes, nice. Thank you very much. And today we'll talk more about the hip surgeon in US.
Yes.
So, for started, we want to know, could you describe for us a little question, a typical training pathway
Sure.
For a hip surgeon in the United States?
Sure. So it starts with university, typically 4 years of university, during which time one does pre-medical studies.
Perfect.
So basic science stuff, organic chemistry, all those fun things.
Yes, nice.
After that, if you apply, you can try to get into medical school.
Okay.
Medical school is 4 years.
4 years.
Everyone has to do that.
Okay.
That's perhaps the biggest hurdle. It's a very difficult challenge getting to medical school in the United States. It's extremely competitive.
Nice.
But if you get into medical school, you are there for 4 years.
Okay.
During that time, you study usually 1 or 2 years of sort of basic medicine stuff like histology, pathology, biochemistry, that sort of stuff. And then 1 or 2 years into it, you begin doing the clinical rotations.
Okay.
And you do clinical work across the spectrum of specialties. Some of it, of course, is general internal medicine, some general surgery, and then subspecialization areas that you're interested in.
Okay, nice.
Typically, in the third year, you have to make a decision about what area of specialty you might want to go into.
Okay.
And then people do their applications to residencies at the end of their third year. And then sometime in the middle or late of the fourth year, they know which specialty they will go into. It's become quite competitive in orthopedics and a few other specialties, for example, plastic surgery, dermatology. So sometimes students will take a year or two off and do research to get their curriculum vitae even stronger. Not everyone, but many.
Okay.
For those very, very competitive specialties.
Not so easy.
Exactly. And then the specialty that you choose will have many different places where there are training programs, and there's what's called a match. Okay. Which means that the medical student puts in all of their choices, the various training programs put in their choices, and then on one day on a computer it puts them together. You get the highest choice place that ranked you highly.
Okay.
So then you start residency. Residency is typically 5 years.
5 more years.
5 more years.
Oh my gosh.
The first year is what they call internship, which is sort of generally basic medical training. You're taking care of ICU patients, emergency room patients, patients on the floor in general surgery, and a little bit of subspecialty training in orthopedics. After the first year, you start your orthopedic time to 4 years, and that typically involves going through the various different parts of orthopedics, usually twice during your 4 years.
Okay.
Once as a junior resident, once as a more senior resident.
Okay, so now you talk about 4 years and more 4 years, and now
5 years.
5 years. So
yeah. So after high school, it is 13 years.
Oh my gosh.
Okay, so it's pretty long.
Okay, and then
if you are going to be a subspecialist in orthopedics, typically you'll do 1 year of fellowship.
Oh, okay.
And so that's a separate application. Most people do it at a different institution from the residency because they want to get different perspectives.
Perfect.
And most people nowadays do a fellowship because in the U.S. it's pretty competitive in many of the big cities to do orthopedics.
Perfect.
So they want to have a subspecialty, for example, joint replacement, for example, sports medicine, for example, spine or hands. So they do a 1 year fellowship typically, and then at that point they got to get a job.
Oh my gosh.
So
Before
typically 14 years.
old.
14 years.
Yes, listening you, I can see a little difference from us.
Yes.
Because here in Brazil, you have to study a college, 6 years.
Yes.
And then we stay a residence for more 3 years.
Yeah.
And then you can choose specialty. So
Yes.
you do more 1 or 2 years, depends of the
I see.
hospital. So we talk about 6, 3, 9, and more 1 or 2, 10 or 11 years.
It ends up being pretty close. It's a long path wherever you train because let's face it, becoming a surgeon takes a long time to learn.
Yes, I understand you. This is the same.
Your system is a little more like the European system in that the university and medical school are combined as one application. Whereas in the United States, they're separate steps.
Yes, sure. Okay, nice. Good to know, Dr. Daniel.
Yeah.
Dr. Daniel, and for the second question that we want to ask you, what are the main difference between residence and fellowship programs in your country?
Yes. So during residency, typically one is learning all aspects of orthopedics.
Okay.
So you need, no matter what specialty you go into, you need to know how to do trauma. You need to know something about arthroscopy. You need to know something about joint replacement. So during residency, you should get a broad opportunity to learn in all of those areas, broad training.
Yes.
During specialty, you're doing just one area of training. So, for example, for me, it was joint replacement of the hip and knee. So I did just hip and knee replacement for a year. Many people would do some other specialty, for example, sports medicine or spine surgery or hand surgery or pediatrics. But during that year, you're doing just one area.
Okay.
Number two, you have a little more responsibility as a fellow. You're expected to know how to operate by then.
Perfect.
You may be doing some things more independently.
I understand you.
Usually under the good supervision of a mentor, but a little more independently. And the other element of fellowship that is common is to have a little bit of academic work. Okay. So maybe writing some papers, doing some good projects, trying to move the field forward a little bit.
This is good because I don't know. We don't know how it works in our country, but listen to you. This is good. No, it's good for us because we understand now and learn a lot about this.
Yeah.
And another question: how is a surgical expert and case volume structure during hip training in the USA? What do you think? Is a lot or a little bit? What do you think?
Well, I think by the time someone has done a fellowship, they will have had a lot of experience.
Oh, nice.
And the surgical training in the United States is based on a very graduated approach to independence.
Okay.
So at the start, maybe somebody at the very internship here is doing just learning how to close the tissue. And then as a junior resident, they may be learning about the exposure of the hip, for example. As a senior resident, they will be doing the surgery, but under careful supervision.
Perfect.
As a fellow, they may be doing more complex surgery, like revisions and things like that, but also with supervision. And maybe some of the more straightforward surgeries in some programs or some surgeons may be letting them do independently.
Okay.
So it's a graduated process of learning. But by the time someone is done with a fellowship, they will have done a lot of surgery in their specialty.
Nice.
And they will be competent to go out and do it on their own at that point.
Okay.
Now, that doesn't mean you don't keep learning. We all learn
sure.
our whole career.
Of course.
But they do a lot they have a lot of experience by the time they come out.
And in the median, how many surgical in 1 week or 1 month?
It varies a lot from program to program, and it varies a lot from specialty to specialty.
Perfect.
But I would say in the course of a year, most of the residents would be exposed to somewhere around 500 surgeries per year.
Really good.
And then over each year, there's,
perfect. Really,
5 or 6 years of that.
Really good, very good. Now let me ask you one question of my own.
Yes.
My question. How important do you think it is for a hip surgeon to practice in their fellowship? I mean here, actually getting hands-on.
You have to have the hands-on experience.
Perfect.
I'm not saying that it has to be totally independent with no one else in the operating room.
Nice.
In fact, I think it's better if you have the hands-on experience with an expert watching you, telling you that's good, don't do that, do this. That's fine.
I agree.
But you have to do it with your own hands.
Yeah.
Watching is not good enough. Your own hands have to learn.
Perfect.
But
Perfect.
I personally believe that the safest for the patient is to have somebody learning with their own hands while an expert is with them, helping them. Of course, at some stage you have to get some independence too, and that's an important, careful balance.
Yes, not so full. And I'm agree with you. And I think depends if the hype surgeon is interesting too.
Yes.
This is so important too.
I
because
agree.
you have to take action, to put your hands, to listen, to learn and practice. So
Yes.
this is very important, and I'm really agree with you. And for the final, I would like to ask you something, and I want that you can talk free about what advice would you give to international doctors who want to learn from your patients, your participation in training programs in US?
It's a great question. There are different ways that an international doctor can become involved in training in the U.S.
Okay.
One way is to try to have all your training in the United States. That's difficult because the U.S. surgeons have priority in getting into the programs.
Perfect.
But it is true that some international surgeons do that. If you're going to do it, you have to have the boards already done. So you have to have the USMLE boards. If you don't have that, you have to start early. You have to start early if that's your plan.
Yes.
If that's not your plan, you can do your training in whatever country, let's say Brazil.
Okay.
And then you can try to come as a fellow. Typically, most fellows, if they're going to do a clinical fellowship, also have to have their boards.
Okay.
So most fellowships require you to have boards because they want you to be able to practice, they want to be able to bill for your services, and they want you to be able to do independent things.
I understand.
So you can come as a fellow. Let's say you haven't been able to do either one of those, but you want to come to the United States. Many of the big university hospitals and big academic hospitals like our place have visiting programs where someone can come for a month or two or three and observe and learn.
Oh, nice.
Now, it's not quite the same as doing it yourself.
Sure.
But you're learning and seeing what experts are doing and talking to them every day.
Nice.
Making good connections. And we've had lots and lots of international visitors who have done that and continue to come back year after year and establish a relationship. It's a good way to do it, actually.
Good. I know that. And then you can put hands on or just hands up?
Usually it's hands up for those situations because you're not credentialed to put hands on.
Yes.
Yeah.
So if I want to do something like this, I have to start early, and then maybe
you have to plan ahead and have your ducks in a row, as they
some
say.
years
Yes.
you have to start to
Typically.
practice. Okay, nice. And for finally ask you, I want that could you leave for us a final message for us hip surgeons who wish to have such a beautiful and prosperous stars like yours, so you can give us a final message. For example, what do you think? What do you think about it? What do you think about the future? What do you really think? Please.
Well, one thing that for me has been really interesting to watch is how quickly orthopedics has developed in South America.
Okay.
I can tell you, I've been coming to South America to give talks for probably almost 30 years, off and on.
Okay.
And when I came 20 or 30 years ago, there was a big difference between what we could do in North America and what can be done here.
Perfect.
That difference has changed dramatically. It is now tiny, and maybe it's the same here as it is in the United States.
Understand.
The training is good, the surgeons are good, the surgeons are knowledgeable, and the availability of good implants is high.
Okay.
And some of that, I think, relates to the improved economics in South America. There's a lot more money available in medicine.
Perfect.
Some of it involves, I think, the availability of information by the internet and other means. It's just easy to get information quickly wherever you are in the world nowadays.
I understand you.
And some of it has to do with just the maturation of the specialty in South America. You've got several generations now of very talented surgeons, especially in joint replacement. And the training is very good, and the level of expectation and knowledge is very good. So it's come a long ways. It's great to see it.
I understand you. And I think that, what about the technology? Do you think is
The technology
come
is,
to
I
stay?
think it's almost the technology for sure will continue to change.
Perfect.
And continue to evolve. There's no doubt about it. What we have now will be very different from what we have 5 years from now.
I understand you.
But the important thing is that you in Brazil have access to most of the same technology we have access to now. Sometimes that maybe not every hospital does, but many do.
Perfect, Dr. Daniel. So we at SBQTalk Like to thank you again, once again, for the presence and for the talk, for this conversation. So really, thank you very much, and
thank you.
A pleasure that you are here with us.
I've really been happy to be here. You put on a fabulous conference.
Oh, nice.
Really good scientific content, very well organized, run very well, on time. Good speakers, so that was great. And I also would say that for me, it's a special thing to come back because I've got a lot of friends here.
Oh, nice.
And it's always really fun to see good friends in another country.
Good.
And the hospitality and generosity all of you have extended to me has been fantastic.
So, really good.
It's made it a special trip for me. Thank you.
Thank you very much, and see you soon, of
Thanks
course.
a lot. Likewise.
Ok, thank you. Pessoal, finalizamos aqui mais um SBQ Talk. Dr. Daniel Berry nos trouxe muitas informações, muita experiência. Então te agradecemos e até a próxima. Obrigado.